everyone. Today, MemoMap, we are going to master body temperatures. First, you have to remember that normal body temperature is around 37 plus minus zero point 0.6 Celsius, and to maintain or keep our temperature, the heat production should equal the heat loss. So, where does the heat come from? The heat comes from two sources: the cell metabolisms and the muscles contraction, either voluntary like during exercise or involuntary like shivering. How does the body lose the heat? We have the three main systems: the skin, the lung, the urinary, and GIT. The skin is most important, and the skin allow or help in heat loss through three mechanisms: the sweating, but remember that sweating without evaporation, the heat will not be lost. So every sweat should be evaporated, and the evaporation is lost during the humidity weather. The second is conduction, touching the cold object remove the heat. Convection, moving the air carry the heat away from the skin. Regarding the body temperature, we have two types: the shell temperature, which is the skin, and change according to surrounding environment, and the core, it is the temperature of the internal organs, and it remains constant and it's closely regulated. How about measuring of the body temperature? We use the thermometer, and we have three common sides: the oral, the axillary, the Richter. But remember, the Richter is the best for assessment of the core temperature. Finally, remember that the core temperatures change by many factors: physiological and pathological. The physiological, circadian rhythm. In the early morning, the core temperature is the lowest. At the afternoon, it's the highest due to the activity. Regarding the age, the core temperatures is the lowest with all, highest in the adults due to the activity. Regarding the gender or the sex, the male have a higher score than the female due to the activity and muscle bulk, while the female have the highest core temperature mainly after the menstruations. Also, the exercise affecting the core. During the exercise, the core temperature increased. There is an individual differences. Some people have a chronic high core temperature due to the genetics problems. And finally, the endocrinal, especially the thyroid, play a role in the core, since the thyroid controls the metabolism. So the hyperthyroid increase the core temperature, while hypo decrease the core temperature. And now, you need to know who keep your body at 37 degree. Simply, it's our thermostat, which is the hypothalamus. But before the hypothalamus can make the decision, it first needs to be informed about the temperature, the core and the skin temperatures. And the temperatures here is regulated actually by three parts: the sensor part and the control center, which is the posterior hypothalamus, and the response. Let's start with the sensor, which is the thermoreceptors. There are two types of the thermoreceptors: the peripheral thermoreceptor located in the skin and detect the temperatures outside the body, and send the information through the lateral spinothalamic tract. And we have the central thermoreceptor located in anterior hypothalamus and monitoring the core temperature mainly. So the pulse thermoreceptor sends the information to the posterior hypothalamus, and now comes the most important rule of the posterior hypothalamus, which is comparing the temperatures, mainly the core temperature, with the setting point, which is 37.1, and accordingly it decides whether to respond or not respond. So if the core temperatures equal to the setting point, so there will be no response, nothing will happen. However, if the core temperatures is higher than the setting point, the anti-rise is activated, and if the core is lower than the setting point, the anti-drop is activated. So we have peripheral central thermoreceptor sending the information to our thermostat, which is the posterior hypothalamus, and the posterior hypothalamus compare mainly the core temperature with the setting point, which is 37.1, and decide. as we said, if the core is more than the 37.1 or the setting, the anti-rise start. And here for the anti-rise, we focusing mainly on increase the loss or decrease the gain. For increasing the loss, here we focusing on the sweating. Remember that the sweating is an active process, and the sweating will not cool our body without evaporation, and evaporation is inverse related to the humidity. So if we have a humid weather, evaporation will not occur, and the sweat fail to cool our body. To decrease the gain, we focusing on two things. The muscles activity decreased, and also the blood vessels should be dilated, and the resistance decreased to increase the flow from the core to the skin, so the heat will be lost through the skin. The opposite occur if the core is less than the setting point. We activate the anti-drop mechanism, and here we increase the production and decrease the loss. We increase the production mainly by the activation of muscle contraction and hormone, focusing thyroid and catecholamine. Decrease the loss by vasoconstrict and behavioral, like wearing more clothes. And now let's apply everything we learned into common situation, the fever and the exercise. Starting with the exercise. During exercise, your muscles work hard, so the muscle contraction equal heat production. So the core temperature rise above the 37.1 setting point. The hypothalamus detect this and switch to anti-rise mechanism, and here the aim is to cool the body mainly by sweating and vasodilatation of the blood vessels. That's why during exercise you feel red, hot, and sweating. Second case is the fever. During the fever, here the story is different. The body is getting hot, but first the infection activating the white blood cell, release cytokine, and this stimulates the prostaglandin, and this rise the setting point in the hypothalamus. So now the core temperature become less than the setting point. So this activates the anti-drop mechanism. That's why you first express shell, shivering, and vasoconstriction. And now what will happen if you treat the infection or if you have an antibiotic? Removing the cause will result in decrease the cytokine and prostaglandin, so the setting point return back to the normal, and now the core temperature become higher than the setting point, and so the hypothalamus will switch to the anti-rise mechanism, so you will feel sweating, vasodilate, and flushing. So with the exercise, remember the core temperature rise, so we activate anti-rise. In the fever, you have two phases. Before the treatment, you have an anti-drop with a shell and shivering. After treatment, you have the anti-rise with sweating and flushing. Now the cause time, look at this graph. There is two curves, blue for setting point, red for the core temperature. Can you tell whether this graph represents change in temperature during exercise or fever? Please write your answer in the comment and explain why. Come to the end for today. Let's put everything together in one final MemoMap recap. Remember that the normal body temperature is 37 plus minus 0.6, and to keep this normal, the body follow one golden rule, that the heat production should equal the heat loss. The productions is mainly by cell metabolism and muscle contraction, the loss mainly through the skin, and through the skin by sweating, evaporation, conduction, and convection. And don't forget that sweating does not cool the body if the evaporation does not occur. So two body temperatures we have, the shell and the core, and the core is almost constant, and to measure the core, the best site is the rectal. And the core temperatures usually change by the circadian rhythm, age, sex, exercise, individual differences, and endocrinal. And to regulate the temperatures, we have a thermoreceptors and posterior hypothalamus. We have two types of thermoreceptors, the peripheral and central. Remember, the central is in the anterior hypothalamus, not the posterior. The information from both peripheral and central go to the hypothalamus, which comparing mainly the core with the setting point, which equals 37.1. If the core is higher than the setting, so the anti-rise turn it on, and its aim is to increase the loss and decrease the production, mainly through the sweating, vasodilatation, and decrease the muscle activity. If the core is lower than the set point, so the anti-drop mechanism turn on, and its aim is to increase the production, decrease the loss through the vasoconstrict, shivering, increasing the muscle activity, and two hormone increased. Remember the thyroid and catecholamine. Remember, finally, in the exercise, the muscles contract while the setting point is normal, so the core become more than the setting point. This activates the anti-rise with sweating and vasodilatation. In the fever, the story is different. In the infection, the setting point changes and the core become less than setting point, and this activates the anti-drop. That's why you feel chill and shivering. After treatment, the setting point return to the normal. The core become above the setting point, and this activates the anti-rise with the sweating and flushing. And that's the end for the day. Before we end, don't forget to answer the today's quiz. Look at the graph and tell me, is it showing an exercise or fever, and why? See you in the next MemoMap episode.